Essentially, in a healthcare environment, it's pretty chaotic. It's highly paper-based and processes are very manual today. In addition to that, information is required in very time-sensitive situations. There is also very low tolerance for mistakes and errors. In addition to that, there's always the need to track people, assets, medical supplies, etc. And most importantly, I think when you also look at some of the global challenges today, the ratio of caregivers versus patients is so low. There's always more patients than the number of caregivers. Today, the adoption of technology across Asia Pacific, I would say is gaining a lot of momentum, especially across some of the countries today where the government is actually looking at increasing the quality of patient care. They're also looking at managing the patient's care from a life cycle perspective. In a recent study done by Technomic Asia, the China healthcare IT investment in 2008 was actually more than 1.2 billion. Now the total market for this is expected to grow to about 2.9 billion US dollars by 2012. And during that time, it is also expected that 70% of the hospitals in China would have moved to a digital era. In Australia, last year, 2009, the government invested in a $100 million project on electronic medical records. That again is signaling the embracement of technology to digitize the existing patient records within the Australian healthcare. Closer to home in Singapore, most people have read the reports. Our government have also invested close to $140 million US dollars, that is, in the electronic hospital record system, and that is poised to be rolled out by November in 2010. This why IT is actually gaining a lot of momentum. It's also because as markets are gaining maturity, there is also an expectation for better patient care. And like I said, especially in Singapore, the government is actively looking at managing the patient's life cycle management. For example, patients who go into acute hospitals for specialized treatment, during their recovery process, there is two things that the caregivers need to look at. One is to make sure that the recovery care is not compromised during the recovery phase, but more importantly, the care is actually affordable and accessible to the patient. So one of the thinking is around how do we pair, for example, acute hospitals today with some of the community services hospitals so that patients can be transferred once they're in recovery mode to have the right care, but at the same time to be able to afford the right care during the recovery process. Today in Asia Pacific, definitely top of mind for most of the government is around healthcare services, and particularly e-healthcare. Is one of the top items in the agenda. I think if I look at the trends across Asia Pacific, we have seen government looking at not just short and medium term strategies, but also long term strategies. Let me share with you. In the short and medium term, for mature economies like Singapore, they're definitely looking at making sure that patient care services are actually accessible to every single citizen. They're also making sure that patient care services are actually affordable so that every patient will not be deprived of the medical services that they require. So in the short and medium term, a lot of the investments from the Singapore 2010 budget goes into helping to make sure that the infrastructure is in place, the right processes are in place, and the right technology is being implemented to afford the citizens with better care. Say for China, which is a large market, fairly emerging in a lot of ways, they too have a government healthcare reform, and a lot of the investments today are focusing on two key areas. One is upgrading the infrastructure of the hospitals so that they are better equipped from a technology perspective to respond to the necessary critical situations in healthcare. The other that they are trying to do is also to some extent balance the load of the patient care that they can deliver either through the provincial hospitals or the rural hospitals, so that there's a more balanced spread in ways that the government can deliver healthcare to the larger population of the citizens in China. That's kind of the short and mid-term strategy. When you look at the long-term strategy, one of the pressing problems that most mature economies will face is actually the aging population. That too, in Singapore, you see that increasingly the government is paying close attention to forward plan what are going to be some of the needs of these aging population, as they're going to be less mobile, perhaps they have less disposable income. So how can we continue to deliver the right quality of care to these aging aged populations without compromising on, again, their accessibility and affordability. Likewise, in countries like Japan and Australia, aging population is also a grave concern for the government, and delivering healthcare to this population is definitely top of their agenda when they think about long-term healthcare. The embracing of technology in healthcare, definitely standards is key. I would break down the term standards in a few ways. One is standards in terms of the format of the data. Today, because health environment is very much a very paper-based environment, you've got medical records in forms, right to X-ray, in X-ray films, and you potentially have electrocardiogram data in another digital format, rather hard copy digital format. So when we look at embracing an electronic solution to make sure that a patient's history of medical records are all aligned and tagged correctly, the challenge I think healthcare organizations will face is firstly making sure that that single format is able to handle all the existing traditional paper or hard copy format of the data in various forms. That's one challenge. The other challenge I see would be interoperability. Today, when an organization deploys a digital solution, for example, it is not just a situation within the organization that they have to think about interoperability, especially in healthcare, where there is interaction within multiple parties, even outside of the institution. For example, hospital needing to integrate with community hospitals, needing to integrate with private GPs, needing to integrate with maybe specialist doctors in a private sector. Because of the need for such integration, interoperability becomes key when an electronic solution is being considered, because we have to think about forward planning, about what are the existing standards that these entities use today in the market, and more importantly, how do we share these data in an efficient manner. The third challenge obviously would be around data security, protection, and of course privacy. So in the electronic world, the transfer of information needs to be secure and done in a predictable way. And more so in healthcare, where every individual's medical record is private. So the assurance that these transfer of data eventually still maintains the integrity of privacy is actually pretty important. Finally, the last two areas I'll touch on would be making sure that the system that's being implemented is actually easy to use by the caregiver. Today, they feel that it's easy because it's all in paper and they know exactly which cabinet to get the file. But when it's in the electronic form, navigating throughout, across the digital world may not be as easy for some caregivers who are perhaps not traditionally that used to in an IT environment. So making sure that it's easy for them to use becomes really critical. And lastly, of course, accessibility. Healthcare, as I said, is a very time-sensitive environment. They need to make sure that in a digital form, they are able to access the right information at the right time.